In terms of our study process, it was an 18-month study process. We held 5 committee meetings where we as a group convened at the Institute of Medicine, and we held many other meetings over the telephone, or teleconferences. We had 3 public workshops that were attached to these committee meetings, and in these workshops, we invited experts in various areas to share their perspectives on different key issues. For example, one of the key issues that we looked at was health disparities and the roles that nurses can play in eliminating and addressing health disparities. And so we invited experts in that area to come and join us for the meeting. We also held 3 public forums, and these public forums were held all over the country in different places. There we invited experts as well as everyday nurses to come and testify and share their ideas with us. We engaged a wider audience through social marketing. So we had, individuals submitting, testifying online and submitting their opinions prior to the meeting and shortly thereafter. And these public forums were focused on different areas in nursing. One focused on acute care, another in care in the community, and the last one that we held was focused specifically on nursing education. We also collected literature. We had a database of about 600 evidence-based research articles that examined critical issues that were relevant to the future of nursing. We also commissioned 5 papers on areas that were weak in terms of being addressed in the literature, and we needed additional information on. And then we also were able to access the research network at the Robert Wood Johnson Foundation, who houses experts in different areas that are of importance to nursing. For example, there was experts in nursing workforce and healthcare workforce issues and supply and demand, etc. And then we also did interviews with nurses to learn about some of the innovative things that they were doing and to showcase them as part of as being case studies as part of the report. And so at the end of this process, we developed a vision of what the future was. To be able to know what potential roles nurses can play, it would be important for us to envision the future of healthcare. So what we envisioned was a future where quality, patient-centered, and compassionate care was accessible to diverse populations, where the healthcare system intentionally promoted wellness, that it wasn't just focused on acute care, but also worked in the area of wellness and prevention, where primary care and prevention were the central drivers. That's where we spent most of our money on, providing primary and prevention. And then where interdisciplinary collaboration was the norm. It wasn't the exception. So where all healthcare providers worked in collaborative group and were able to utilize each of their resources and each of their capacity to the full extent. And then finally, a system that rewarded the value of healthcare, not necessarily just the volume of healthcare. So this would be a great future. I would love to have a future like this. And then, of course, nurses would be a key component of this future. They would be full partners. They wouldn't have the current limitations that they currently have in terms of providing the care that they're able to provide. And so there's 4 key messages in which our recommendations are shaped. I'm gonna share the specific recommendations with you all as well, but it's sometimes easier just to remember what the 4 key areas are. The first is that nurses should practice to the full extent of their education and training. So we've talked about that being one of the big issues in terms of what the nursing profession faces that doesn't allow us to provide as much good as we can provide to society. The second key area is that nurses should achieve higher levels of education. And in doing so, this needs to be seamless. There needs to be seamless transition from nurses that graduate with an associate's degree to be able to have opportunities to go on and to get more advanced degrees, to get their bachelor's, to get their graduate degrees. We believe that nurses generally want to have better education. There's just a series of limitations, whether it's financial, lack of opportunities, that don't permit nurses to advance their education. The third was that nurses should be full partners in designing and making decisions about healthcare. Full partners, of course, with physicians and other healthcare providers. So nurses need to have a more visible and more dominant leadership role in our healthcare system. And then the last one is that we need better data. That's all, that's usually one of the last recommendations of everything. But a lot of the questions that we were asked to address in terms of what is the exact numbers of nurses that we would need in the future, and what areas do they need to practice? We were unable to answer those questions because we have old data that is constantly changing and not enough data to be able to make those predictions. So, for example, we just got the 2008 data on the national sample of nurses, and we know that between 2006 and 2008 there's dramatic changes. So if we're making decisions now on what the future would be on data that is given from 2008 and now it's 2010 and that's changed, how are we going to make effective decisions about the future when that data is old and incomplete? So now I'm just going to go specifically into more of the specifics of the recommendation. So under the first key message of nurses need to practice to the full extent of their education and training, there's really just one large recommendation that we developed. And this recommendation has various sub-recommendations directed to each of the organizations, individuals, or entities identified here in these bullets. So we have recommendations to Congress, state legislatures, Centers for Medicare and Medicaid Services, Office of Personnel Management, to either change laws that would allow nurses to practice to the full extent of their education or training, or to create mechanisms to put pressures on insurance companies to provide direct reimbursement for nurses. So for example, one of the sub-recommendations here asked for the Centers for Medicaid and Medicaid Services to limit funding to states that have limited scope of practice for nurses. So that would be seen as a pressure for these states to change their laws so that they're able to reap the benefits of these funding opportunities. The last one here with the Federal Trade Commission and Antitrust Division of the Department of Justice was something that was identified by President Shalala. And here we're asking them to look at anti-competitive effects that scope of practice laws have on a state level that would limit choice for patients, that would limit the ability that a patient has to choose an advanced practice nurse practitioner if they wanted them to be their primary care provider. And a lot of states are actually doing that, and here in Florida, there's some movement in this area. So this is an example of the 11th Street Family Health Service of Drexel University. This is a nurse-managed health center that provides primary care as well as health promotion and disease prevention to diverse and vulnerable groups in the area, and they have seen tremendous results in the care that they provide. There's similar nurse-led health clinics around the country that look very similar to this. And they've been able to track their health outcomes and find that the care that they're providing is resulting in improvements in hemoglobin levels for diabetic patients, cholesterol, blood pressure levels, depression. There have been a decrease in low birth weight infants, increased immunization rates, and increase in breast cancer screening. So they've seen tremendous improvements in the health. And you can just think of what would happen if this type of model of care was widely disseminated and every community had access to this type of care. We'd see remarkable and revolutionary improvements in our healthcare. Another example is in advanced practice registered nurses in Iowa who have been able to increase access to care for many individuals in rural areas that don't have access to primary care physicians. And as a consequence, they've seen that the health of the community has also improved. And again, this is also seen in other states that allow expanded scope of practices for nurses.